Good afternoon, everyone. Welcome to our Talking Tuesdays. My name is Tanvi Sharma, and yes, sorry for the delay. I was just having some trouble with my, internet connections. Sorry about that. So let me just add the Divya to this. Today we are going to talk about the premature baby. And as you would have seen from our Insta post, it's actually in continuation of our Know Your Baby series, and it's probably one of the last that we would be doing in this series. Hi, everyone. So I'm just waiting for Divya to join. All right, Divya is here. Thank you for joining us this afternoon as we talk about the premature baby.
Hello.
Okay. I think Divya is going to join back again. Yes.
Hello.
Hi,
Do I have a
Divya.
bad connection? Hi. Do I have a bad connection again?
Properly or okay. Yes, can hear you, can see you now.
Okay, good. Good. Hi and good afternoon.
Good afternoon, everyone. We are really sorry for the delay. I have a little one and they hid my tripod somewhere. So I had to look for my phone's tripod, which I couldn't find. So I had to, make like a pile of boxes and keep my phone on top of it. And then the internet
Okay.
acting up, so can't really help it. That's Tuesdays for
That
us.
little story was worth it. It's worth the wait.
Yeah.
Okay. So, anything before we start today, Tanvi, or should we jump into it?
We can just start.
Okay. So we want to talk about premature baby. And the reason why I feel that our Know Your Baby is not complete without premature baby is because majority of people look at premature baby as a part of the birth, but they seem to think that things will go on like any other baby. And a lot of people think about premature baby as a bit early or a bit low weight. But there is a lot more that goes on with a premature baby. So in terms of being parents, in terms of if you've had an experience with a premature baby or you're supporting somebody or you know somebody with a premature baby, these things will be very important. So premature babies are a little bit different than full-term babies. So let's just start with what is prematurity. On the face of it, babies are to be born between 37 weeks of gestation to 42, whereas somewhere in the middle is considered a due date. And it depends from protocol to protocol, what is a due date. So we have countries which think 40 weeks is a due date, and we have countries that think 41 weeks is an appropriate due date. And that is not the subject to where we go, but just bringing it up to say that the time is not rigid. It's not like a shelf life or best before date. So if this is the period where the baby seems to be arriving at full maturity, and we are going to consider the baby's point of view more important than the calendar, because they are the ones who know how mature or how ready they are. If birth happens anytime before 37 weeks, at the face of it, it's considered a premature baby, and the care would start to look like for a premature baby. And of course, over a period of time, when evaluation is done, we would also bring in like a layer of functionality, is how good the baby's functions are in terms of being with themselves in this world, which is breathing, sucking, digesting, connection, and all of the other pathways that we talked about. And that's the outward assessment, but there's also an inward assessment. So if the baby is, say, born slightly before or even at 37 weeks, but has issues with respiration, we are still looking at a functionality deficit. And a really important point here comes when we look at this idea of premature baby is that when we think that we have ticked the box of 37 weeks and we decide to intervene and get the baby out, on the baby's timeline, the answer is not 37 weeks or 38 weeks or 36 weeks. It's about, am I ready to function outside? And weight is a part of it. Weight is one of the assessment parameters of it. So we know that babies can be born as early as 25, 26 weeks and survive. And even at 37 weeks, when it is being intervened or imposed as if, okay, it's time to come out, they may still not be ready, and we may see some deficits of functioning. And that is really the broader perspective that I want to bring to mind, because once we tick that full-term baby, 37 weeks, we feel that getting the baby out now, it's the same. But consider what the baby might be doing or what might be happening in the womb from week 37 to say 42. It's a 5-week period. And if you're talking of every day as important, then 5 weeks is a really long term. And we find that babies who are brought out early do show some adjustment in their respiration, and because lungs are the last things that are being developed. But if they, for some reason, happen to come out early, we will find a completely different baby, because this baby will now need a lot of support to finish the work that they were supposed to do had they stayed in that extra month, week, day, or whatever it was. Let's consider it like that. But the most important thing is that the parent of a premature baby is a different parent than a full-term baby. And here are some of the differences that I want to bring up. And while they're very obvious, we may not be thinking about it. So the first step is that a full-term baby, there is an anticipation and preparation around welcoming the baby. You know, you brought the baby to full term, you know that labor will happen at any time, you know that there is a hormonal sequence that is at play that is working with the baby and with the mother. But whereas premature babies are usually something that happens suddenly and it's shocking. The second very important thing that happens in a full-term baby is the baby comes out, the baby comes back to the mother. So the continuity of that process is established. But a premature baby would probably go into a neonatal ICU, which is a NICU. So here there is an abrupt end to your pregnancy and a separation. And while we can cognize that in our really neocortex brain, but on an emotional level, on a physical level, there is more of a loss of an experience, a fright of, is the baby okay, a separation, which takes away the next sequences of birth for us. And this is from the parents' point of view. Their ability to meet the baby is really limited in the NICU. Their contact is probably just through the little portholes that might be available to touch the baby. And depending on what the prematurity is and what it brings out, there may be other medical considerations. And so for that case, what would it feel to a parent, both internally as it's making a transition into parenthood versus how the outside world sees it? Also, it's really not, even though the birth of a child is a celebration, there is so much uncertainty about the well-being of the baby. So in terms of how parenting and what we are offering as parents, our capacity is quite challenged and diminished. And we really had an intense experience that is very much less than optimal. And therefore, the support around these parents have to look very different than a celebration of a full-term baby. We are finding that there are certain expectations when we see a baby. So a premature baby doesn't quite look like a full-term baby in many, many different ways. First of all, in appearance, because they've lost that time to put on fat and their thermoregulation is really poor and they need that extra equipment to keep them warm. And so when you're looking at a baby who's in say, a NICU warmer and with all the tubes, that is certainly not the baby that you had thought of. But from the baby's point of view, they've lost the environment of constant warmth, which is, and also the tissue and the water. And now they are in an environment which is air, which has a texture that is different and a more rigidness, no matter what the mattress is like, a more rigidness. So what we realized is that babies in utero are growing or developing in relation to the stimulus provided. And that stimulus is really gentle and constant and autonomous, which means when the baby is hungry, he gets food. The breathing mechanism is already there. So the oxygen transportation is already there. So all the resources or the blueprint of the baby is towards development. Whereas when we bring this baby out and depending on their channel, they may be having something that is breathing for them, but it's using a different circuit. Their circulation needs to now adapt much before time. They might need, so the warmth is not autonomous. It could be too warm, too cold, so it needs constant care. They may be, their organs that were depending on all these stimulus and input is now challenged. There may be a feeding tube to feed them. So there is a lot more invasive experience of the baby himself than what was there in the womb. And just to appreciate for a moment, because up until now, we're only concerned with, okay, what do we need to do medical to keep the baby going and survive? But also what is their experience of approaching life in terms, it's really tenuous. Like, I don't know where I'm surviving. And then all of this invasion to keep going. And the loss of stimuli that says we are safe, which is the mother's voice, the mother's movement, her touch. So much of that input is lost. So lots and lots of babies find that their brains get a little bit disorganized because of this sudden change that has happened. And that is why if you see a lot of literature around premature babies talks about parents going there, they're talking to the baby, they're touching the baby, they're reassuring the baby. So we're trying to create as much stimulus around the baby as possible. And of course, there are challenges depending on where the baby is, whether their lungs, whether it is their eyes, the retina being developed, whether there is their brain being developed, whether what this process has done. And of course, the fundamental question that why did this baby come before time? So, this isn't about somebody did something wrong, but there definitely is an understanding that there was a challenge to carry on uh, the way they were, and they needed an exit for a better chance of survival. So you'll have to start looking at premature babies as saying, what about this baby was not okay to be inside? And that could be nothing to do with what the mother did or did not do. It could be something that the mother herself was caught up with. So whether it was malnutrition, whether it was anxiety, whether, of course, each one of us as parents would like to do things that will help give an optimal environment of the baby. But inside, what the mother's experience cannot be discounted, the family's experience cannot be discounted, the stress of everyday life cannot be discounted. There could be infections, there could be a problem with the mother's health, or there could be a problem with the baby's health. So basically, one of the ways to get through without the guilt and the grief the parents may feel is to say that the baby has shown some amount of survival intelligence to say, can I come out and be better looked after than what I'm doing inside? And that might be one of the ways to settle with it, though it's just uh, an orientation to how to get through this because it's challenging itself. The one of the most important things that is very challenging both for babies and for parents is the need for that social interaction. You know, full-term babies gaze at their parents, but premature babies, the eyes are not yet quite gazing. In utero environment is a very, it's a very barrier-oriented environment from overstimulation. So there's layers of water, layers of skin, to not let all the sense organs be flooded with information in utero. But outside the world, there's a lot of overstimulation. So that is one of the challenges that babies will feel. And it was really interesting because once we were having a discussion over it, and they said that while newborn babies reach out to their parents, premature babies, when they're overstimulated, actually splay their hands and say, stop. And they tell their parents that that's too much for me. And what we find is, and there was somebody with me who said, oh, is that what it was? As we heard this information, because they said, when I had a premature baby and she would do this, we would say, oh, she's saying hello. And then
High five.
everybody would gather to talk to her, and then the baby would just close her eyes. And then they'll say, oh, she's gone to sleep. But interestingly, neither was she saying hello, and nor was she sleeping because she was habituating, trying to cut out that extra stimuli because her brain was getting overwhelmed. So understanding this stark difference between premature babies and full-term babies and their need from us and their challenges in the world will allow us to parent them in an appropriate way. But also, what is really important here is that we don't separate parents from babies right now, not physically separate, but in our mind, because the baby still should have been inside. They are not separate entities. The parents of premature babies are going through their own challenges, which also then makes them a little bit unavailable to be fully present for their children. So as a second layer of support around that baby, family, society, languaging, interactions with parents should be supportive, keeping in mind that they are challenged too. And then as babies, they do well, they grow, they develop, and they can sustain themselves without medical help. They may be discharged and they come home. That's not the time when we start to think of them as full-term babies. It's not. We always consider that their experience through this is still being played out in their development. And when we become mindful of that, we might help contain that intensity so that they can process it better. We will see different milestones. So, the age, if you say by the calendar, might be that the baby was born two months early. So the baby is now 2 months old, but actually the baby is not 2 months old. They're just at the corrected calendar age. And we must consider that when we are considering milestones. We may find that premature babies take longer to achieve milestones because they're also dealing with high levels of, survival energy that is trapped in their bodies. And they might need a little bit different care. And parents also might need a little bit of different support when they're supporting the babies who are premature. So just a little bit of reverence for life, for this intense experience. Not offering advice that you're not fully aware of is correct. Being supportive can also mean I'm here. What do you need? How can I, because they'll have a schedule. They'll have to visit the baby in the hospital. They'll have to be there. So how can you support them with that? All of these things, whether you're a parent and asking for that help, or if you are a support person supporting, and by supporting the baby in that is very important as yet another pathway of how you know your baby and parent. So Tanvi, that's about a premature baby.
So, Divya, usually a full-term baby loses 10% of their body weight, almost 7 to 10% of their body weight, in the first 10 days.
In
Is
the
that right?
first 5, 7 days, yes.
So, does that same happens with preemies?
No, not at all. They cannot afford to lose weight. So they may be as low as about a kilo or even less. They cannot afford to lose weight. Therefore, the feeding tube and that aggressive feeding so that they keep on growing. Remember, inside Tanvi, they are getting food and what they need all the time.
Correct. Yes.
Here, we can't really give them what they need because we don't know. That mechanism is lost with the placenta. But the calories itself are the first level of survival. So premature babies are pretty much working at the edge of survival, which also shapes their psyche later.
Right. Okay. The other question we got during our breastfeeding workshop also was around breastfeeding a premature baby. So, can that happen, and how does that happen, especially when they are in a NICU?
So they may be fed breast milk, and
Yeah.
premature moms make a different quality of breast milk. The composition of the milk is different. But the sucking activity is there. They're not producing. Again, we are talking in terms of calorie because we are at the edge of survival. The effort that they're going to make with sucking, or depending on how premature they're and functionally, is that working or not? That would decide whether breastfeeding would be the activity or not. But keeping in mind that we talked that breastfeeding is actually not about only milk.
Correct.
How are we recreating that parenting paradigm for a premature baby? Especially that a large part of the baby's input in utero is about the mother's body, the beat of her heart, the breath, the vocalization, the vibration, the warmth, the touch, the tissue. And here we have very, depending on whether they can be moved to a kangaroo care or not, whether it's just touch and voice, we are never going to think in terms of what is being lost. So we know that our whole paradigm is shifted. We want to harvest what can be recovered. So we will not talk about breastfeeding being lost, but can we offer breast milk? Is that adequate? If not, what else is possible? Can we add the calories? Can we add the touch? Can we bring the voice in? Can we have the mother's presence there or the father's presence there? Can the baby not feel alone? How much of that paradigm that is lost can we replace or recover? That would be our approach. And that approach can be quite challenging because what one breastfeeding can do, now we are challenged, especially because of the distance between the mother and the baby or the father and the baby, we're challenged to do it. So if we take our approach to process and say, how much can I recover? What can I give the baby? What can I offer? And keep on acknowledging that, yes, this is not the same. Yes, you are having an experience. How can I help? That would help us, and that would be more beneficial both for parents and for babies rather than saying that, oh, this is lost, so I have to achieve that. I don't have to achieve breastfeeding. I have to achieve everything that breastfeeding brought to the baby, and how can I best restore that? And then as
Right.
soon as they're able to suck and swallow, and they can come to the breast.
Okay. So, for the knowledge of mums, can they express and offer that at least from feeding point of view,
Yeah,
at least breast milk if they're not able to, at least be
breastfeed.
there physically?
Yeah.
Okay.
Yeah. But they'll also have to understand that because the calorie need of the baby may be
That was
high, what they're
higher.
expressing right now may not be fully acceptable, and they may need.
Right.
So there could be a breast milk bank that can be providing, so that how we say breastfeeding from the mother, then breast milk of the mother, then human milk, and then artificial milk. So we can
Right.
go through that. Also understanding that when moms have had such an intense experience, because breastfeeding is also about how the mother feels, all this
True.
information and acknowledgement of her experience, support around it. If we can't do anything, we can always share a hug or a tear. It is an emotional time. Might that be able to help her with expressing? Because expressing is all about how she feels. So a
Correct.
woman who's now feeling the pressure to express because she has to give breast milk to her child versus a woman who says, okay, this is my experience. Let me see what I can offer and be in that state to offer. That would be a whole different paradigm. But yes, it's possible with the right support. Because no matter what our experience is, we are human above all. And a human support is in the core of our very humanity, being together. So yeah, breast milk will help, but the burden of it cannot be on the mom. So what she gets as breast milk is a plus. Not giving breast milk is not a minus. And we'll keep talking in terms of plus with premature families so that they can add their resources and build it.
Right.
And
So
here's
we have
another challenge that I might say, that depending on how premature she was, how quickly the milk will come, because there's a hormonal gap, and that would also be a consideration. So just be kind to
sure.
yourself. Yeah, sorry.
So sorry, I was just saying that there's one question, and she's saying that she had a premature baby at 27 weeks, and from developmental milestones, when will she be able to do the catching up?
Okay, so that's a very generic question for a very specific issue. Now, 27 weeks is the calendar age, right?
Yeah.
But we don't know what the baby's experience was and how much the baby was developed and what support they needed. So you can have a 27-weeker stay in the hospital for a couple of weeks and be absolutely okay and go back. And you can have a 37-weeker having a respiratory issue. So it's not linear. That's number one. Number two, also acknowledging what her experience was and whatever work was being done in the body. How did the foundation of that being was laid versus if it had been inside? And this is not to say that babies in utero do not have challenges in development. They do, depending on so many aspects of the mother. But what was the challenge? And how will she, so instead of saying catching up to milestone, which is an ideal, how will she optimize her milestones may have been another way of looking at it. Would premature babies have some kind of, you know, how to say deficit? Possibly can be, but not for all. But that can be also true for full-term babies who are challenged later. So we can't look at the building of a child or a human being as, if the time has passed, you have arrived here. That's not good enough. And to give you a very similar example to understand it, when you go from 40 to 50, not everybody ages the same way. You will see 70-year-olds who do physical fitness, and then you'll see 50 years old who have trouble getting out of bed. So age itself cannot be functionality. And what are the factors you would say that affect health or how we are with age? Are the very same point of views that you can have right in the beginning. So say if that time the baby's heart had a bit of a challenge in development, it can either do the full development, given the conditions are supporting it, that is, they're looked after, they feel safe, or it may not. And then that may be a challenge for a while. And then over a period of time, they may meet it, maybe not in the time period that we thought they would, but later, or not. And they adapt to that and learn to live effectively with that little challenge. So it's really not a linear this thing. My suggestion would be that you pay attention to the child, you understand how the mechanism works, the process, and you support the growth of that process. When you support the growth of that process, there'll be an incremental change or development, and everything will build on it. If you look at milestone and see deficit, that will always be a problem, because either you will push the baby too much or you'll be disappointed. It's like building a muscle. I'll give you an example. If I just say, okay, I'm going to build my arm muscle and I exercise and I pay attention to what I can pick up or not, and gradually, incrementally build on it, and then maybe eat protein and have a diet which is good, and then, all of that, then I will build that muscle. But will everybody's muscle build at the same rate and similarly? No. But if I look at saying, oh, she's my age and she's just like me, but she's lifting say 100 kilos on a squat and I'm not, I might hurt my back. So you have to pay attention to where you have to reach and the process of it and just support that process. And most importantly, your child would want to know from you that you're doing well. Not that, oh, you're not doing this enough or you're not getting there. But yeah, oh, you're improving. And that's a delight. I really don't know why we are parents. Maybe that's also a deeper dive into, why I have this child and why I have this challenge, which would again become a more consciousness, mindfulness approach. But incremental change, if you see, you will make the baby reach to the potential that they're capable, and we don't know what that is. They may surpass what anybody may think as a milestone, or they may not, and that's okay.
Right. We have another question, and Neha is saying, from perspective of pre and perinatal challenges they've had, are there any long-term effects to look out for to be able to support premature baby?
There definitely would be, because they've seen a survival crisis. Well, when we look at birth, we always look at it as a survival crisis. From the baby's point of view, either they will make it or they will not. It's as black and white as that. But there are a lot of mechanisms postpartum, right after birth, that tells them that they are safe. We're encouraging them, that skin to skin contact, that eye contact with the mother. Premature babies don't get that. So it only makes sense. If we were to have a life and death crisis and have had a slow recovery out of it versus a short-term shock and bad, it does affect our psyche, and so it does the babies. But the thing about human is that the healing lies within. There is potential of healing and restoration of paradigm, not abilities and measurable, but restoration of paradigm is always possible, which means the baby may arrive at a point saying, I am here, I am well, I am safe, I am loved, I'm alive. And that is possible at any level. Right?
Yeah, true.
Yes, because yeah. But they also might also ingrain on the other side the need to say that they have to do more than others to survive. And that might become a personality trait as well. So when we start using labels for them of survivors and fighters, what that might do backwards. So, and it's really hard not to do it because we are human. And I was just writing something, and he said that our brain are our biggest, strength, because it's programmable. And because it's programmable, it's our biggest limitation. So which means at one level, our brain can learn anything. But as soon as it learns something, it becomes its restriction. So at every point, we want to appreciate what's going on. We want to acknowledge it, but we don't want it to become the story. And I think that's what mindful living is all about. Yeah, being a fighter
Right.
can be both good and bad. That's true. Yeah.
We have another question, and she's saying, I have a preemie born at 34th week, and he is in his 4th month now. Keeping milestones aside, health-wise, is there any long-term effect that I should look out for in terms of immunity of the child?
Yes, of course. So babies who are born premature do have immunity issues, and you might find that catch up may happen much later. So a little bit of protection, a little bit of exposure and building of immunity. They might have trouble with putting on weight. So these are definitely challenges, because the systems that would have optimized in utero because of the conditions of the uterus, of being in the womb, have been lost, and that is one step down. The other step down is to just keep going. There was a lot more challenge. So it's a double whammy. And yes, of course, it may be a possibility, but it's not for all right. So this is something that I do want to qualify. That we see again, the once we know something, we might get limited by it. We're acknowledging the potential that, and how can we support it. That would be our pathway of future.
Right, great. So that kind of answers all our questions. and also covers our topic for today, which was the premature baby. In case you have any more questions, and for people especially who watch our video later, you may just drop a comment or just send us a direct message if you have any questions for us, or any comments or love. So you may send it to us. And so thank you so much for joining us this afternoon. And we'll see you next Tuesday. We have something very interesting coming up, so watch out for us or for our Instagram handle, and we'll soon be announcing it this week.
Yeah, we're always racking our brains for something interesting.
Yes, absolutely. So that's what keeps us going as well. And Divya being Divya, she has to come up with something very different and unique for
I'm
everyone.
hoping. Okay.
Yes. So thank you so much, everyone, for joining us this afternoon, and we'll see you next Tuesday. Take care. Goodbye.